Come on in, have a seat. I'll sit over here. I see you've been self-harming again. Why are you doing that to yourself? You're gonna have scars everywhere. It doesn't make it go away. You actually have to take the medicine and do the hard work. That's the only thing that's gonna help you. I mean, I don't know. Whoa. Pause for a second. That is ineffective. Something else you might try is saying, I know that your emotions can get overwhelming sometimes. Are there any things that you do that are not helpful to your body that help you deal with those emotions? Is there anything you'd like to tell me about? The feelings just get so big and I don't know what to do with them. So I just feel like I gotta do something that hurts more than what I'm feeling inside so that the pain will go away. What do you mean you're not taking your medication? Don't you want to feel better? Come on now. I'm pretty sure that we've talked about this. I told you it takes at least a month to get into your system. So you trying to tell me it doesn't work, what do you want me to do if you're not going to follow through? I'm just not, okay? Just because. Wait a minute, that's not effective either. Something else you might try is, do you have any reasons, either financially or your situation at home, that's preventing you from getting the medications and medical treatment that you need? Would you like to tell me about them? I'm just kind of struggling right now. Like, my dad just lost his job, so the insurance isn't there, and medication's expensive. I don't really have a way to go pick it up. It's not that I don't want to take it. Really, I want to feel better. I just don't know how to get it. Don't you have food at home? Fresh food? Why do you choose all this unhealthy stuff to eat? You should be eating fruits and vegetables every day. You should eat at least 3 times a day and then have some snacks between. It's not healthy not to eat. And it's definitely not healthy to eat all that junk food. We got plenty of food. There's food and stuff at home. Wait a minute. She's not going to respond to you like that. Maybe try something like, can you tell me about the situation at home? Do you have the financial means to pay the bills, to get the food that you need? Is there anything, any resources I can give you that might help? Well, my dad lost his job, and so we have some things at home. I wouldn't really say we have stuff that you can make a meal with, but we have, like, you know, a cup of noodles or macaroni and cheese. We just don't have the things to make it with. And, you know, with him not having a job, like, the bills aren't getting paid, and so, like, we don't have any lights right now. I really don't know where to go or what to do. And just why aren't you going to class? I thought you said you wanted to graduate and go to school to be a teacher. Do you think that you're going to become a teacher by not going to school and skipping class? Come on now, you're smarter than that. I mean, I don't know, I sleep late and it's a lot harder to get to school, and I just don't want to be there. Wait a minute, where do you think that's going to get you? She feels embarrassed now. Maybe try something like, are you able to get to school? Is there something going on at home that keeps you from being able to get to school on time and go to class? Do you not have the supplies that you need to do your homework? Let me know what you need and I will work with you to try and fix this issue. I do try to get to class. I want to graduate. But it's hard to wake up in the morning when everyone's fighting all night long and I don't get hardly any sleep at night because the meds that I'm supposed to take to help me sleep, I don't have those at home. I just feel kind of lost right now. Just how many sexual partners have you had? At least tell me you're using some contraceptives. Why does it matter to you? I mean, that stuff's expensive. Why do you care? Wait a minute now. That's not going to get her to answer anything. How about something like, your sexual health is important, and I want to make sure that you have as much support as you can get so that we can supply the best care. Is there anything about your sexual history that you'd like to discuss? Whether you use contraceptives or you choose not to is your decision. Is there anything I can do to make sure you have access to what you need? I don't really do that kind of stuff. I mean, I'm not really interested anyway, but I just don't feel like I'm ready for that. I don't have any partners. I'm not even dating right now. I don't know that I ever want to. I mean, if I did, I would use condoms or the birth control thing or whatever. But I'm just not interested right now. Is somebody abusing you? You need to tell me if they are. No? No, I'm sure. Really? Again? How about your environment is important to your mental health and physical health? Is there any concerns about your home or the people you're living with or your neighborhood that may be causing you to feel stressed? Anything that you need any support with? Would you like to talk about it? I think they're just stressed out, and I think I'm just adding to their stress, and then they yell at me and then call me names, and sometimes they hit me, but I don't know. I don't think they don't mean to. They're just so overwhelmed right now. So clearly there is a therapeutic and a non-therapeutic way to ask the same questions. Your patients will show how they feel about your questions based on their tone, their words, their body language. Are they pulling their knees up to their chest and guarding themselves? Are they turning away from you to face the door? Are they hiding their eyes? There's many different ways that trauma shows up in responses of our patients. So it's important that we find the way to communicate the most effectively so we can get open communication with our patients.